This is Jefferson Close Up. I'm Carol Saline. My guest today is Dr. Dan Kremens. You did something very interesting. You practiced law for 7 years before you went to medical school. So what was that about?
So when I was younger, I was sort of conflicted as to whether I wanted to be a doctor or a lawyer. And so I think at that time, took the path of least resistance and went to law school. And I loved law school. Law school was great. But when I started to practice law, I realized that I didn't think it was what I wanted to do with the rest of my life. I just didn't find it very fulfilling. So,
Yeah, but that must have been a major decision. Now, you are a neurologist. And what in particular drew you toward neurology?
So neurology for me was exciting because it was a real combination of the body and the mind. And unlike some other areas like pure medicine or pure psychiatry, I found that neurology really combined those two interests nicely.
And you specialize in neurodegenerative diseases. Could you describe what that is?
Neurodegenerative diseases include diseases like Parkinson's and Parkinson's-related diseases and other forms of dementias sometimes. They are chronic problems involving degeneration of the brain.
Is that what Parkinson's disease is?
So Parkinson's is a chronic neurodegenerative condition which involves death of brain cells. We traditionally think of it as involving death of cells in the part of the brain called the substantia nigra, but in fact, it's much more than that.
What do you find most rewarding about your work?
The thing I find most rewarding about my work is the relationships I develop with the patients. Parkinson's disease is, for most people, thankfully, a very slow chronic disease. So I'm going to see a lot of my patients for 10, 15, 20 years. I have patients that I've been treating from the time that I was in my fellowship training from before I started at Jefferson who came with me here. So I've been seeing them for years, and I love the fact that I get to meet their families, I get to know the patient on a personal level, and so for me, that's a really meaningful experience.
Now, what are some of the ways that you approach treating your patients over these long periods?
Parkinson's disease evolves as the person, as it progresses. So at different stages in the disease, there are different needs. Early on in the disease, it might be trying to make sure that the person is functioning the best they can. Later in the disease, they might want to be able to try and keep working, so we have to set certain goals.
So what should someone look for in choosing a doctor for their Parkinson's?
The main thing that you want to look for is to make sure that your doctor has a lot of experience with Parkinson's. And so what that means is that most of us do additional fellowship years of training. So you want to be with someone who's had fellowship training, and ideally you want to be at a movement disorder center. That's a center where the physicians are dedicated to treating Parkinson's disease and other movement disorders, as opposed to, just seeing somebody who treats headaches and Parkinson's disease and multiple sclerosis. You really want to be with a specialist.
And there is a big movement disorders center here at Jefferson. And what would you say is special about what you offer to patients?
Well, both Dr. Leong and I are fellowship trained in movement disorder, and I think we bring a broader approach to the problem. We don't just focus on the motor symptoms. We realize that the disease involves far more than that, and we also realize that it's a family issue, and so we try to get the families involved in the treatment plan and program as well.
Sounds like a very comprehensive approach.
That's our goal.
Thanks for coming in.
Thanks very much.